Hi, my name is Brittany Gallardo, and today I wanted to talk a bit about the prescription drug overdose and misuse. Currently, here in the United States, the abuse of prescription drugs has reached an epidemic level, and more currently, we are facing an opioid epidemic, and the abuse of prescription drugs increased quickly, beginning in the late 1990s through the mid 2000s. And opioids are the most commonly abused type of prescription drug and also appear to be the largest contributor to the increase in drug abuse. And this was stated in an article by R. Catherine, Susan Nielsen, and Roger D. Weiss. In a journal that I had found in American Journal of Health System Pharmacy, or AJHP, it stated, and I quote, that the number of deaths by drug overdose in the United States tripled between 1990 and 2014 and reached a historic peak in 2015. I had also found that the National Institute on Drug Abuse stated that in 2015, Missouri wrote 90 opioid prescriptions per 100 persons, which is equivalent to 5.2 million prescriptions. Which brings me to my next finding in the same journal. It stated how prescribers are undereducated when it comes to the appropriate use and prescription of opioids. And I believe that it is true because, like, a big issue is that they're prescribing more than what is needed or actually used in the end. That same article, though, or journal, states that before 1980, opioids were prescribed mainly by surgeons, and during the same time, a pain management thought leader, Russell Portney, MD, gave seminars promoting opioid pain relievers to treat chronic non-cancer pain and argued that no dose of opioids is too high. Obviously, this is, he's a pain management thought leader. This is one of the things that contributed to people believing that no dose of opioid is too high, which obviously is a lie because you do get addicted and overdose, But I believe that, not just, him portraying that there's no dose of opioid that is too high, but like the fact that our prescribers are undereducated on the appropriate use or amount that needs to be prescribed is one of the bigger issues as well. And according to an article from Rebecca Gannon in an interview with Joanne Hatfield, a clinical lead pharmacist here at the Truman Medical Center's Pain Management Clinic, she said, and I quote, "We have really done a lot of work to educate our providers that maybe a smaller quantity is just as effective." And this statement came out of the fact that one of the recommendations for controlling the opioid epidemic is to ask physicians to lower the dosage of opioids being prescribed. Because Hatfield had also pointed that statistics show that many patients that use opioids for recreational use have received them from a family or friend for free. And that's part of the reason is because they have all these extra pills after the prescriptions. So overall, this issue is not ethical because, according to Merriam-Webster's dictionary, ethics is the philosophy of dealing with what is morally right or wrong or what is good or bad behavior. And obviously the fact that these drugs are being misused is, wrong and unethical in itself. And also I found a case study in one of these journals that stated that a pharmacist was voicing their concern over a patient's prescription because his prescription had been, the dose had been lowered and he was back a week early for his prescription refill. So the pharmacist voiced her concern to the physician. The physician said, no, it's fine. She just overlooked it. Said, it's fine. Go ahead and refill it. He has these lab exams coming up. So the pharmacist was left in, this having to deal with this ethical issue of, do I refill it? Being that I disagree with the physician, or do I not refill it? And, what if the patient actually needs it? All these ethical issues came up. So being that, this is a complicated issue overall because in a journal by Marianne Maumus, an MD, she states how physicians need to make decisions in the best interest of their patient, obviously, but all while having pressure from system administrators to cut down the lengths of their visits or stays. And if the physicians are being pressured to cut down the lengths of their visits or stays with their patients, then it kind of makes it, more complicated, and, makes it a bigger issue, because then it's harder for them to be able to look for signs of misuse and identify whether a patient is actually ill, and, maybe they are willing to stop using these narcotics, or maybe the patient's just, over exaggerating their pain in order to get prescriptions. And, with them trying to cut down the length, that's, it's just going to be unhelpful, because this does take a lot of time, patience, and practice. It's a big issue. And I believe that we need to make or see a change. We have to start with policies and administrators, and training our doctors to identify signs of misuse, and just overall better communication within our health system. So, but overall, I did ask a family member what their thoughts on the issue were, and they stated that they believe that they're overprescribing. There's too easy of an access. Anybody can get them, these, drugs, prescription drugs, and even young adolescents. Which brings me to my own experience of what I've seen growing up. I remember that when I was in high school, going to house parties and stuff, a lot of people would be selling opioids. The most common were oxys, hydrocodone, and codeine, the syrup form. And these were just used for before party, after party, during parties. A lot of people were just drinking this, even, in schools. And a lot of these pills, for the most part, were being obtained from older family members who had, extra prescription pills, or just, the kids had access to them and were able to steal them. Or, you get prescribed these pills because, you get your teeth pulled out, but for the most part, you get prescribed more than what's needed, and this becomes a cycle. And in an article, which I mentioned earlier, by Catherine, Suzanne, and Roger, they had also stated how data from a 2013 Monitoring the Future study, which is an annual survey of 8th, 10th, and 12th graders in the United States, there was a reportedly alarming high rate of non-medical use of prescription drugs, and opiates were the most commonly abused of medications, with almost 13% of 12th graders reporting opioid use. So, like I said, in high school, that's what was being used, and it doesn't surprise me that a lot of these young adolescents are being affected by it still. And it's gotten to the point to where, according to Stephen Johnson's article, on October 23rd, Trump declared that the opioid epidemic was a public health emergency and promoted a campaign that focuses on preventing misuse among young adults. I had also read that Cerner, alongside with Truman Medical Centers, has developed a new software, Cerner's Opioid Toolkit, which is supposed to help doctors and nurses access when a patient of theirs has already been prescribed opioids, and if that patient should be prescribed any other opioids. Also, it should be able to tell them whether their patients are doctor hopping, trying to get prescriptions from different locations. And one of the good things about this is that while it is taking effect here in Missouri first, Cerner has many clients all around the nation, and they do plan to roll this out to all of their clients, so it should touch all over the nation, and hopefully should make a good impact on this epidemic we're having. But I did hear in a presentation from Sarah Knott, which was a guest speaker in Urban Health earlier this week. She spoke about how substance abuse disorder met the criteria for being a chronic illness, and Sarah works with Collaborative to Advance Health Services, which is part of the UMKC School of Nursing and Health Studies. And she talked about how common features that substance use disorder has with chronic illnesses are that it can be influenced by environment or behavior. Response to appropriate treatment can be ongoing and long-term. And she mentioned how a lot of the stigma around those with substance use disorder, and a lot comes from the word drug abuse. And even the government uses the term abuse, which is often related to negativity. And, a lot of the stigma is associated with poor mental and physical health as well. And it has been proven to be the top reason why people don't access treatment or appropriate treatment, but appropriate treatment has been proven to better the health. And while it may not bring them back to 100% brain function as it did prior, it does show great improvements. And, that's just the thoughts of someone who is working with people with substance use disorder based off these prescription drugs, like opioids and stuff and heroin. But I do believe that from here, we need better monitoring programs, especially the Cerner opioid toolkit, to be put into work at every hospital and or clinic, especially in states with high prescription drug overdose and misuse. We need this topic to be seen in a more ethical and crucial matter, as there's already been so many overdoses reported, and the numbers have just increased over the years. Like specifically in Missouri in 2016, we lost 900 lives to overdoses. But so because of that, this needs to be taken more seriously, especially because our young generation is being easily affected, and it's already easy access for them. So I do hope that the Cerner toolkit, along with campaigns, begin to prove to do some good and reduce the way drugs are prescribed and the number of people misusing prescription drugs and overdoses. I know it won't be done overnight, but I do hope to see a progress within a year or so.